pretty kind of subspecialized by now. So I'm a trauma surgeon by training. So I take care of patients with surgical diseases that are more acute, meaning that they need immediate attention right away. But things like patients who are involved in, say, a motor vehicle accident and comes in with some type of traumatic injuries that need to be dealt with right away. Along the same line, patients with acute surgical pathology, let's say appendicitis, gallbladder disease, kind of infection or inflammation in along their gastrointestinal tract, the intestines, the colon, things like that. Those are the most common patients that I see. I happen to be practicing at an academic institution, so I have also responsibilities to my residents and my medical students. So I also, teach and give lectures, and I also do some research on the side. So no 2 days are exactly the same, but that's how you keep things exciting.
So co-op stands for cooperative education. And Waterloo is now home to the world's largest cooperative education program, with over 7,000 employers hiring our students every year to do real work in real organizations. And so cooperative education really is like a system of study that integrates semesters of paid work experience with academic semesters. And so it's a truly integrated model into every year of your education before you graduate. It's similar to like a paid internship, but it does happen more than once, and it's not a placement service. So it is something that you're actively applying for, and then you're building your resume and you're making these contributions to the workplace, but then also taking what you're learning in the workplace and bringing it back to the classroom, and vice versa. What you're learning in the classroom every year and every term, you're bringing to those new work experiences. So there's lots of possibilities, lots of options to do co-op. About 70% of our students are currently enrolled in the co-op program. So not all programs offer this working system, so the co-op program, but really it's your chance to discover what you love, and maybe sometimes discovering what you don't love. And like Dr. Neo had mentioned already, that it sort of helped him figure out what he wanted to do after graduation as well. So you do get to try out 4 to 6 different work terms. You build your resume by gaining almost up to 2 years of work experience in your field of study or interest. You'll, of course, improve those interview skills before you graduate, and then promote yourself to employers and possible future industries and opportunities. You can help fund your studies by earning a full salary, and it ranges from industry to company to company. And around 92% of our co-op grads are employed within 6 months of graduation. So it is really valuable hands-on experience that will, help you network, help you build those really valuable skills before you graduate. And so like I said, not all the programs at Waterloo do offer co-op. For example, the program I was in, biomedical sciences, does not offer co-op, but there's other ways of, doing those and getting those skills. So building your resume, finding work terms, just in a different sense. You can also gain different certificates to showcase and market your different skills. So there's still things in place and a support system for students who are not a part of our co-op program as well.
Waterloo is one of the pioneer when it comes to co-op programs in Canada and probably the world. So what it means was, you study full time for 1 term, and then the next term you're working full time for the whole term. So I ended up graduating in 5 years, And by the time I graduated, I've already accumulated about 2 years of full-time working experience. And back then, like I said before, I wasn't sure. I knew I wanted something to be, to something health related, but I wasn't sure which kind of direction I was going to go. So I make use of the opportunities for me to explore the different fields of health. One term I was working as a research assistant at a molecular biology lab. The next term I was doing some outcome research at a psychiatric hospital. I was working as a project manager for a health promotion program for a regional government. So I kind of touch on all those little different fields within health, and found out that really I wanted to be working directly with patients, something that's really hands-on, and that's how kind of ultimately affirmed my decision to go into medicine and apply to medical school.
So not only that, your co-op experience helped you to identify the specialization that you want to pursue further for your study, but I just wonder whether the years of experience that you have accumulated during co-op will play a factor in your residency application as well?
Well, absolutely. I mean, I got to know a lot of things in life is all about networking. Knowing the right people who can help you along the way, right? So when I was working at the molecular biology lab, I got to know the principal investigator, who happens to be a very renowned doctor at the University of Toronto Medical School. Just by working with that group, I was able to get a letter of recommendation when it comes time to apply to medical school. And I believe that letter helped me a lot. So yeah, just knowing kind of, it's one thing to just go to school and go to class and study. It's another thing when you're really working full time and getting to know people and network with people. Not only does it provide you with a real life working experience, but it also makes you, a much more well-rounded individual. You're able to get to know other people in the field who have a lot more experience than you do, and they can provide a lot of help for when it comes the time for you to move on to the next step.